Good morning, everyone. Today we're going to be discussing attention deficit hyperactivity disorder and attention deficit disorder. I will be referring to both just as ADD. Nowadays, there seems to be a lot of misconceptions about this as a diagnosis. So our goal today is to try and dispel the most common myths with some factual and hopefully interesting information. Okay, so for our first fact or myth, ADD is just the latest excuse for bad parenting. Fact. Scientific studies on ADD suggest that there are biological imbalances of neurotransmitters in the brain. Some researchers suggest that individuals with ADD have uptake transporters for dopamine and norepinephrine that are overly active, and they clear these neurotransmitters from the synapse a lot faster than normal individuals. This means that individuals with ADD have a problem with the search engine of their brain. Their knowledge is stored in the cortex, but accessing it, prioritizing it, and keeping it all in mind is problematic. Okay, so for fact or myth number 2. Myth. Children with ADD will not have any associated behavioral problems in the future. Fact. Children with ADHD have an increased risk for developing other types of behavioral disorders. Some studies have shown that about 50% of kids will develop oppositional defiant disorder and/or conduct disorder at some point during their development. Most important thing parents should do is seek treatment and behavioral management to prevent the development of these more severe behavioral problems. Okay, so for fact or myth number 3, myth, children can outgrow ADD. Fact, if untreated, ADD can continue into adulthood. By seeking behavior management and medication when needed, individuals can learn to develop their strengths, structure their environment, and manage to have very productive and fruitful lives. According to Parenting Magazine, we have actually found some celebrities and scientists that have a diagnosis of ADD. Justin Timberlake, Jamie Oliver from Food Revolution, Will Smith, Albert Einstein, Michael Phelps, Beethoven, and Pablo Picasso. Okay, so for fact or myth number 4. Myth. I can't have ADD. I'm not hyperactive. Fact. Hyperactivity is only a symptom. Only a number of ADD sufferers experience hyperactivity. There are 3 subtypes of ADHD. Predominantly hyperactive and impulsive, predominantly inattentive, and the combined type, where individuals experience hyperactivity, impulsivity, and inattentiveness. Okay, for our last fact or myth. Myth number 5, the only effective treatment for ADD is medication. Fact, a comprehensive treatment plan is best. While medication is proving to be most effective, a comprehensive treatment plan, including psychological, educational, and social measures, have the best outcome. These therapies aim to improve the child's behavior by getting parents and teachers involved and on the same page. There are some examples of behavioral therapy that should be used as initial therapy, and they include enhancing the amount of positive feelings between parent and child by setting aside 30 minutes for special time, avoiding asking too many questions or giving commands, rather just being interested and complimentary to what the child is doing. Second focus of behavior therapy is giving positive reinforcement for behaving appropriately. Okay, so now we're going to discuss what to do if you think your child has ADD. Make sure you set up an appointment and go see a provider. Have a physical exam done. Obtain 1 or more ADD assessments or behavior checklists for the parent and 1 for the teacher. And your doctor may prescribe behavior treatment and or pharmacological treatment. Medical science has come a long way in its ability to recognize and treat ADD. Still, there's no single ADD test available to help doctors diagnose this common disorder. Talking with patients and family members may be the most important diagnostic tool doctors have for ADD. Through talking, the providers can learn about the patient's daily moods, behaviors, productivity, and lifestyle habits. A physical exam will show the patient's overall state of health. but the doctor needs to know what specific ADD and symptoms a child or adult has to diagnose and effectively treat ADD. When making a diagnosis, it's helpful if the doctor obtains one or more ADHD assessments or behavior checklists from the child's parents and teacher. If applicable, a teacher or caregiver from an after-school program should also fill out an assessment. If the doctor makes an ADD diagnosis for your child or an adult family member, it's important to adhere to prescribed treatment. Your doctor may recommend ADD medications, and he may also recommend behavior therapy. So now we're just going to cover some assessments that are useful in the ADD diagnosis. Some common rating scales include the Vanderbilt Assessment Scale, which is a 55-question assessment tool reviewing symptoms of ADD/ADHD according to the DSM-4 criteria. It also screens for coexisting conditions such as conduct disorder, oppositional defiant disorder, anxiety, and depression. The other assessment is the Behavior Assessment System for Children, BASC. This scale assesses such things as hyperactivity, aggression, and conduct problems. It also addresses anxiety, depression, attention, and learning problems, as well as a lack of certain essential skills. The last behavior checklist is a Child Behavior Checklist Teacher Report Form. Among other things, the scale assesses physical complaints, aggressive or delinquent behavior, and withdrawal. Okay, so here we're just showing you an example of the Parent-Informant Vanderbilt Assessment Scale. Answering these 55 questions will help the doctor make the diagnosis for ADD. Understanding these common misconceptions will help you relate the associated facts to your patients. Hopefully this presentation was able to help you separate facts from myths.